I now want to turn to Caroline. Again, talking about the need for appropriate funding, and Caroline can talk about some of the innovative financing you're putting together at Open Road Alliance. Thank you.
Great. Hi, everyone, and thank you, Chris, for moderating today. I'll start off just kind of following on a little bit about the state of social entrepreneurs and then dig into how Open Road is trying to help solve some of those issues. Social entrepreneurs are the working poor of the business world. One shock, and they're dropped below the poverty line. They live hand to hand. Even in the U.S., they can't find affordable capital. And when they do, it requires collateral that is often overly cumbersome. I was recently talking to a U.S. social enterprise that had $20 million in revenue last year. And they went to a prestigious big bank and said, I would like to open a line of credit for $1 million. And the bank said, great, just deposit $1 million with us, and then we'll charge you 5% so that you can use it. And that's the status of financing in the U.S. So then let's go to emerging markets where there isn't financing available for social enterprises. There isn't clarity around impact investors or DFIs and what types of investments they're looking for and what their criteria are. Some of you may have heard of the Valley of Death, between $250K and $1 million worth of financing for a business. It's just not available in the market in equity or debt. Some of the DFIs do a good job once you get up to the $3 to $5 million range, but you know, you need the money first to be able to grow to get to the $3 to $5 million range. And you know, people often ask, why aren't there any unicorns in impact investing in social enterprises? And unicorns are companies that have a valuation of at least $1 billion. And I say to them, this is their growth pattern. It's growing, disaster, growing, disaster, and having to rebound from that when there really isn't any safety net or insurance product for the social sector. So that's where Open Road comes in. We are a private philanthropic initiative that was founded to keep impact on track. We provide contingency bridge financing, both in the form of grants and loans for when unexpected roadblocks happen. We have no sector geography focus, although much of our work is in sub-Saharan Africa. I would argue because the safety net is less apparent there. But we have found that about 1 in 5 projects, 1 in 5 companies run into some sort of unexpected funding need. We have some data now that kind of splits what types of roadblocks people are running into. And over the long term, we'd like to have a robust data set that can predict if you are a healthcare social enterprise working in East Africa, here are the top 3 roadblocks you're most likely to run into, and here are some solutions for you. This roadblock analysis found that the biggest problem is actually funders. And so I'm not here to name and shame, but I am here to shame. And delay of disbursement was the #1 problem that these social enterprises and nonprofits run into. And you know, we need to have internal champions that are fighting to improve the sexy processes that get money out the door. Because when a social enterprise doesn't get funding on time, perhaps they don't have enough money in their bank to make payroll that month. And then how do you think you continue on that growth trajectory when employees are having to make trade-offs between paying for their kids' school fees and transportation costs to work? Just want to give you one example of a project a company Open Road funded recently. A company called Flare in Nairobi that provides access to medical assistance to ambulances within 15 minutes. And there are plenty of ambulances in Nairobi, but to this point there's been no way to make sure the ambulance closest to the emergency is the one dispatched to that. So it creates a central system that works across different private hospitals and ambulance providers to help get the closest ambulance to the emergency. They were integral during some of the uncertainties around the elections towards the end of last year in making sure that ambulances got to people that needed their help. They were raising their seed round of investment, and their lead investor had a heart attack. They were literally days away of closing their investment round, and of course this person needed to recover and was not in a position to transfer funds. So Open Road stepped in with a bridge loan and kept their impact on track. Another example is an organization similar to Live Well, working in Rwanda, called One Family Health. They are a franchise clinic model working with rural clinics operated and owned by skilled nurses. And they're integrated with the National Health Insurance Program and actually have served up about 10% of the population at this point. Unfortunately, the government of Rwanda can sometimes be a bit delayed on their payments. And so they needed a bridge loan to be able to have enough money on hand to purchase all of their equipment and drugs to be able to continue providing services. So these are just a few examples. I would say the biggest gaps we see outside of kind of the longer term working capital issue is just bridging these gaps to committed funding. So if USAID, there's a lot of great programs there, but if the funding gets approved in June and doesn't come till December, they need a bridge loan to get the work going on day one. Receivables delays is also a thing we see frequently, where because they don't have access to a working line of credit from a local bank, the whole company freezes up. And then the last thing is actually a good thing. Some companies unexpectedly receive large purchase orders and they don't have the financing to be able to deliver on that. And so again, they have an opportunity for their scale to go like that, but they're constrained because the capital is not available. So maybe I'll pause there and throw it back to you, Chris.